Good morning. My name is Tony Zhang. I'm the Associate Dean of Allied Health in the School of Health and Biomedical Science here at RMIT University. Today, my colleagues and I are going to tell you a bit more about complementary medicine programs, which include Chinese medicine, chiropractic, and osteopathy. These programs are well known in the profession and allow students to work across a variety of disciplines to replicate the real-world experience they will need once they start their career. Also, we had knowledgeable staff available on the live chat. So please feel free to submit your questions via the chat function. Next slide. Before I start, RMIT University acknowledges the people of the Voi Wulong and Bon Wulong language group of the Eastern Kulin Nation, on whose unceded land we conduct the business of the university. RMIT University respectfully acknowledge their ancestors and elders past and present. RMIT University also acknowledge the traditional custodian and their ancestors of the land and water and online across Australia where we conduct our business. Next slide. RMIT is committed to redefine its relationship in working with and supporting Aboriginal and Torres Strait Islander self-determination. The university's goal is to achieve lasting transformation by mutuing its value, culture, policy, and structures in a way that embed reconciliation in everything we do. In line with the principle of Bungee, we are changing our way of knowing, working, and being to support sustainable reconciliation and activate a relationship between Indigenous and non-Indigenous staff, student, and community. Next slide, please. The three complementary medicine programs offered at RMIT University are part of the National Registration and Accreditation Scheme. Under the Australian Health Practitioner Regulation Agency, there are more than 800,000 registered health practitioners in Australia. Imagine, that is, 1 in 15 people employed in Australia is a registered health practitioner. There are also nearly 200,000 students studying to be health practitioners in Australia. I hope to see you joining as part of the workforce. The key message here is the program you are interested to study at RMIT has received approval from relevant national board and therefore ensuring the most high quality of the standard we will deliver to you. Next slide, please. Work placement are an essential part of this complementary medicine program. So RMIT University, we are very proud it is a top university in terms of ranking in our partnership with employers. We have established a very strong network locally and interstate to allow you to undertake clinical placement. You can also undertake clinical placement on campus with our purposely built health clinic, as well as the external placement. Next slide, please. As I just mentioned, RMIT has built a purposely designed health clinic on campus in Bandura. The clinic is open to the public. It offers Chinese herbal medicine, acupuncture, chiropractic, osteopathy, and psychology services to the public. It provides clinical diagnosis, health advice, and treatment for a wide range of health conditions. Next slide. RMIT is particularly proud as a global university, and we had strong partnership with over 200 universities around the world. You will have the opportunity to undertake overseas placement, overseas study tour as part of your study in approved overseas institution. Of course, we are looking forward for you to joining us for the study. Now, I would like to hand over to the program managers. We start from Dr. Susie Ben Shu, the Chinese Medicine Program Manager. Next slide, please.
Hello everyone, I'm Dr. Susie Mansu and I'm the Program Manager for Chinese Medicine. Next slide, please. So we have two programs at RMIT for Chinese Medicine. One is the Master's Acupuncture and one is the undergraduate program, which I'll speak most about today. The double degree in Chinese medicine has been running for over 20 years and is accredited by the Chinese Medicine Board, as Tony mentioned before. You'll have an opportunity to have both local and global experience, particularly in internship in China once the borders open. And we emphasize the integration of Chinese medicine and Western medicine working together to provide the best outcomes for our patients. Next slide, please. So what is Chinese medicine? There's two main areas that we talked about. One was acupuncture, which I've already mentioned, and these are where we place fine needles into the skin in specific areas known as acupoints. You'll learn about acupuncture points and also herbal medicine. Herbal medicine involves different parts of types of herbs. That includes things like granulated herbs, pre-manufactured herbs, and herbs like roots, flowers, and seeds. You learn about these individual uses and how to combine them in a formula and prescribe these for patients as part of their treatments. Next slide, please. The entry requirements for Chinese medicine is units 3 and 4 in English, unless you're learning English as a second language. We ask for a study score of 25 or 30 in English as a second language. Our ATAR score last year was 70.8. If you're a non-school leaver and you've done other studies such as certificates or degrees, you may also apply for this program and you don't have to be a school leaver. Next slide, please. So the program structured is we have 5 years. So in the first year of the program, you'll learn the unique theory of Chinese medicine, such as yin-yang 5-element theory. You'll build on that learning to diagnose conditions according to Chinese medicine, and you'll have senior students in the first year and throughout the program to mentor you. And no, you don't have to learn Chinese to learn Chinese medicine. We will teach you some basics, but everything is taught in English. You'll learn in the first year basic biosciences, anatomy. You'll be also introduced to research in health sciences and also learn to communicate and understand what's being involved as a health professional. In year 2, you'll use what you've learned in year 1 and start learning about herbs, how to apply them, how to combine them. You'll use your anatomy that you've learnt in year 1 to accurately locate acupuncture points and eventually learn to needle them as well. In the first 2 years, you'll also get experience in clinical placement, but the majority of it will begin in year 3. In year 3, you'll learn some pharmacology and toxicology, so understanding what Western medicine uses for drugs and so forth, and how that can be influenced by herbal medicines. You'll also learn more acupuncture points. You'll learn what is abnormal in terms of conditions in the body, in introduction to pathology, and you'll learn physical examination. Then you'll head into the clinic and learn some more advanced acupuncture skills. In year 4, you'll be in the clinic, you'll be buddied up with your senior students, and you'll be hopefully co-treating by then and learning different clinical conditions. You'll learn Western medicine differential diagnosis and then also Chinese medicine clinical conditions as well. You'll have different conditions in internal medicine, so those are things like headaches or pain in the body, lower back pain, that sort of type of thing, as well as musculoskeletal conditions. You'll also learn about women's conditions such as infertility and skin conditions in dermatology as well. And you'll do the bulk of your clinical placements in year 4 and year 5. You'll also in year 5 have the opportunity to go to China, hopefully as long as the borders are open, and you'll be in one of the busiest hospitals in China, seeing over 100 patients a day. This program is accredited by APRA and approved by the Chinese Medicine Board of Australia. It's recognised by peak industry associations such as the Australian Acupuncture Chinese Medicine Associations, ANTA, and Federation of Chinese Medicine Acupuncture Societies, so that you can apply to register, become members of these associations, and get recognised by private health funds. Next slide, please. So most graduates will go into private practice once they graduate. They'll either be employment or they'll open up their own clinics. I've had students get together once they graduated and opened up their own clinic together as well. They've worked with other health professionals like osteos and chiros, and some have even started their own dispensaries. Others have gone into research and working with other herbal companies as well. Thank you for your interest in Chinese medicine. I'm now going to hand over to Dr. Sandra Gason.
Thanks, Susie. Hello, my name is Sandra Gason, as Susie said, and I'm the Program Manager for Chiropractic here at RMIT. And I'm hoping today that I might be able to give you a bit of an idea about our chiropractic program. And for those that have never seen a chiropractor before and don't know what a chiropractor is or what they do, I hope to give you a little bit of an idea. And also I want to let you know what entry requirements you will need to study this program at RMIT. But first, let me tell you a little bit about myself. I actually graduated from this chiropractic program in the 1990s. I came to want to study chiropractic through a personal experience where I jumped out of a couch one day and wasn't able to move. I saw a chiropractor, and post getting the relief, I thought, wow, that's incredible. I want to be able to do that one day. And the following year, I started studying chiropractic. And here I am, still practicing chiropractic nearly 30 years later, but also having the privilege of supporting students in the program to graduate as chiropractors too. So let me perhaps start by telling you a little bit about our chiropractic program here at RMIT. This program commenced back in 1975 and in the early 1990s became a part of RMIT. And therefore it's a well-established program and recognised by all of the current chiropractic peak bodies such as the Chiropractors Association and Chiropractic Australia. Our program is 5 years, as is Chinese medicine, as you heard before, and osteopathy. And students undertake our program generally on a full-time basis. And when students graduate from the program, they actually graduate with a double bachelor's degree in health science and applied science in chiropractic. The program itself has quite a solid grounding in the biomedical sciences, that is, to those sciences related to the human body, healthcare and disease. For example, anatomy, physiology, pathology, in addition to then those clinical sciences such as chiropractic science. In the last 2 years of the program, students actually get to work as practicing student chiropractors in real life settings. One at Bandura in the health sciences clinic or health clinic, as Tony mentioned before, showed you that beautiful picture of just the reception area alone, but also in private practices around Victoria and in community clinics. In pre-COVID years, chiropractic students also had the opportunity to undertake clinical placements internationally, a little bit like Chinese medicine, in Samoa, Japan, or India, and they were done in their final year. And hopefully we'll get back to doing that again in the future. Next slide, please. So what is chiropractic? It's actually a healthcare profession, just like the other two that we're talking about here today. And it's considered as primary contact. That means chiropractors can see, or patients can see a chiropractor without a referral from their GP. They focus on treating musculoskeletal pain and dysfunction, that is, issues associated with the muscles, joints, ligaments of the body. And that would include the spine, which we're known to treat often, but also the arms and legs. And examples may include back pain, like I experienced before I studied chiro. It could include headache secondary to a problem in the neck. Could include elbow pain, like tennis elbow, and many, many other presentations. As chiropractors, we mainly use our hands to examine and treat these conditions. The treatments that chiropractors use are quite varied, but often include a combination of different therapies. They may, and mainly physical therapies such as massage, mobilization or manipulation, but also other methods such as exercise, rehabilitation, advice on posture, diet, sleep. So we combine all of these therapies to get the best outcome for our patients. Chiropractors are also one of the recognised allied health professions regulated by AHPRA, as Tony referred to before. Next slide, please. So the entry requirements for chiropractic are not too dissimilar to that of Chinese medicine discussed by Susie previously. In 2021, those that entered our program, 50% of them had just completed year 12, and 30% of the students had undertaken previous higher education study. For those that were entering from year 12, the minimum ATAR score was 60.9. And the requirement for students entering in 2022 would they would need 30 in VCE units 3 or 4 English as a second language or an additional language, or at least 25 in English, English literature or English language. If you're coming from interstate or overseas, those students would need to achieve a study score that is deemed equivalent to those scores in Victoria. To enter the program in 2022, the same English requirements would need to be met as that for this year. But the ATAR score can change every year. In 2022, students can also apply through the Special Tertiary Admissions Test, or a STAT score, or a STAT test score, and that score would need to be at least 155. As I said before, 30% of the students who enter the program at a post-secondary level they would need to have completed at least 2 undergraduate level courses equivalent to the RMIT courses. And our courses are 12 credit points. So they would need 24 credit points that they've been successful in previously. If you need more detailed information about entry into the chiropractic program, you could always look on the RMIT website to the chiropractic program, and there's a lot of detail there that you can actually read after the session today. Next slide, please. So I hope that you can actually read the detail on this slide, as the text is quite small. But what I want to say about our program is that we have a 5-year program. We've got 3 years on the slide here, 2 years on the next slide. The program is studied in 2 semesters a year. And in each semester, you will have both chiropractic subjects and, in the first 3 years, biomedical sciences courses. If we just have a look at the biomedical science courses for a minute, you'll notice that in first year, first semester, we have subjects like chemistry and biology of the cell, or introduction to human biosciences. So you could get a little bit worried that you need to have studied chemistry or biology in year 12, but this is actually not the case. Those courses are designed so that you would be able to come straight into the program and be able to successfully study those courses. In semester 2, we move on to commencing our study in anatomy. And in year 2, we then progress to studying physiology and neuroscience, and complete our anatomy of the head and viscera of the body. In year 3, as Susie said before, we study pharmacology and toxicology, and we study abnormal conditions of the body, pathology. So let's get back to it. What you're interested in, if you're interested in chiropractic, is that we have a chiropractic subject in every semester of our program. So what we learn in those subjects is we learn to palpate areas on the body. We learn techniques that would assess a patient in their presentation for those musculoskeletal presentations that I described earlier, and also how we would go about treating those presentations that patients might have, where we would include teaching on how to use soft tissue therapies or massage, how to manipulate or mobilize a joint. We might use or teach, or we do teach, physiological therapeutics. That would mean treatments like ultrasound or laser therapy. And of course, then all of the advice that we would expect our students to provide, or a chiropractor to provide to a patient, including, dietary advice, posture advice, etc., etc. So there's a lot that we cover in the first 3 years of the program. Next slide, please. When we get to the final 2 years of the program, this is where students start to really differentially diagnose a patient's presentation, both with presentations that would be out of chiropractic scope of practice that we would refer then to a general practitioner, or those presentations that would come to specifically to a chiropractor or other practitioner like an osteo. We also then start our clinical placements in those final 2 years as well, where students enter the RMIT Health Clinic, which, by the way, is, I just have to say it again, it's state of the art. It is the most beautiful clinical environment you'd ever really want to work with. I just want to say that the first day I ever went to that clinic when it was built, I thought, wow, this is beautiful. I'm so privileged to be able to work here. And you too would have that opportunity in 4th and 5th year. Our students also have an opportunity to do sports placements with the AFLW at RMIT and other sports environments, and in our community clinics. Next slide, please. So like Chinese medicine, our students are actually registered with APRA, and our course here at RMIT is accredited by the CCEA, which stands for the Council on Chiropractic Education Australasia. And our students also get an opportunity to connect with other chiropractic students around the world via an organisation called the World Congress of Chiropractic Students, or the WCCS. In years past, we've sent 2 representatives every year to a conference around the world, and they connect with those other students. Unfortunately, with COVID, this has not happened in the last 2 years, this year and last year, but hopefully that's something that we can get back to in future years. Next slide, please. So what are the career outcomes for chiropractors or chiropractic students or graduates? The majority of our graduates, they actually go into private practice. They either start their own clinic, they become a partner with another chiropractor, or most commonly in the early years, they work for someone else as an associate or an employee. They can work with other chiropractors, obviously, as I've just said, but they also work in multidisciplinary clinics with GPs or Chinese medicine, osteo, physiotherapists. But they can also then too work with sporting clubs or teams. And some people choose to move into research, become a researcher, or become an academic after a few years of clinical experience like myself. I think it's over to you, Jackie.
Thank you, Sandra. My name's Jacquelyn Towns and I'm the lecturer in osteopathy and the program manager here at RMIT. It is my absolute privilege and pleasure to speak to you all today about a profession that has given me personally so many opportunities over the more than 20 years that I've been an osteopath. And I guess I'm really excited about talking to you about that today. Osteopathy is a growing and exciting profession, and I hope over the next couple of moments while I have a chance to explain that to you, you'll see where perhaps a career in osteopathy may suit you. Next slide, please. So the Bachelor of Health Science and Bachelor of Applied Science Osteopathy is a 5-year degree that we run at RMIT. We provide treatment plans, advice, exercise, posture, nutrition, and many, many more aspects of patient care over that 5-year period. The osteopathy degree at RMIT was the first of its kind in Australia. So it's been running here for a very, very long time, back from the days of Phillip Institute into RMIT as we see it here today. We very much run the program around work integrated learning. Now, as you've heard from Susie and from Sandra, work integrated learning is where we get to actually apply our skills in the senior years of the program and start to see patients and start to understand the profession that we're going to be part of. But nowadays in osteopathy, there is a hugely broadening scope for where our profession is going. And I hope that I can share some of those more varied opportunities with you this morning. So over the time that I've been an osteopath, things have changed a little bit for us. We were always in private practice, and nowadays we find ourselves working in many aspects of health. So at RMIT, you'll have opportunities, obviously, to work in the work integrated learning that we provide on site at the RMIT Health Clinic, and I'm going to talk a bit about that. But there are also opportunities in other private practices and more broadly in health as well. We are recognised by peak bodies. Oh, next slide, please. So what is osteopathy? We've heard a lot about different allied health professions this morning, and there are some similarities. Osteopaths focus on the neuromuscular system, so that's the bones, the muscles, the nerves, and the other tissues that support your body, and the control they have over your movement. So one of the things that I love the most about osteopaths, or being an osteopath, is how we really consider the whole patient, and we really try to work out and troubleshoot or problem solve our patient's pain and dysfunction. We provide musculoskeletal and nervous system assessments. We actually do hands-on manual therapy. So I'll talk a little bit about the varying types of manual therapy that you'll learn in the course. We also provide clinical exercise programs. We provide advice on movement and postural positioning. We talk about ergonomic assessments, and we also talk very widely about occupational rehabilitation as well. So really important. Osteopaths see patients who come in from no referral from a general practitioner, so we're primary healthcare practitioners, but we can also see patients that have sustained a workplace or a motor vehicle accident, or who are also part of a multidisciplinary approach through Medicare with the chronic disease management programs that they have as well. Your osteopath can offer lots of support and educational advice about your lifestyle, your stress management, your diet, and many of the other factors that influence your pain, your injury, or your movement. So osteopaths at their core really consider patients as a very complex but very interesting problem to solve. So we really work on those connections of the human body and look at externally how we can influence and have an impact on all aspects of our patients' lives. So some of the primary things that you'll learn at RMIT in the osteopathy program are around diagnosis, management, treatment of musculoskeletal disorders. But we have to learn a lot about the human body for that to be key to our application. So we'll also learn a lot about medical testing procedures, the skills applying those testing procedures involve us having a very, very complex and comprehensive understanding of anatomy and physiology as well. Next slide, please. So similar to chiropractic, the ATAR for last year was 60.6, and that's the lowest ranking score that an offer was made. A lot of our students, excuse me, mature age students or coming from another area of study. Sorry. The only prerequisite that we have for the program is those English requirements that are the same for the other complementary courses. And that's simply because communication is a big part of our role. We have to be able to communicate very concisely and very well with our patients in both written and verbal consultations. Next slide, please. So let's look at the program. It is a big program and it is a big undertaking. You'll see, very similar to the other courses that you've heard about this morning, that you'll be doing a lot of biomedical science in those first couple of years. And that's because we really have to have that in-depth understanding of the human body before we can go ahead and start applying it. But that's not to say that we don't apply these things early on. You do have some osteopathic theory and practice. That is a hands-on practical skill class that you'll be doing in those first couple of years as well. And you can see how they're embedded in the program throughout both semesters of those first 3 years. But integral to your first 3 years at RMIT is this in-depth and comprehensive understanding of the human body. And that means right from the cellular level down in our biology of the cell, right out to our neuroscience, where we understand the complexities of our neurological system and brain and spinal cord. Next slide, please. So year 4 and 5 is where we really get going on being an osteopath. That's where we start to really apply these skills, and we're doing more of our work integrated learning. From year 4, semester 1, we spend time in the RMIT Health Clinic, and that's where we get an opportunity to see real patients. And this is a huge step forward for most students. And it really does consolidate our love for the profession that we're undertaking, and gives us a chance to apply in real life scenarios all of the things that we've learned so far. You continue to learn different techniques in these senior years as well, but it is really a consolidation of those ideas that we do in our work integrated learning that's pivotal to your progression into the profession. Like I said before, we do have some other work integrated learning opportunities in the senior years outside of the RMIT Health Clinic, and that's usually in private practices, but more broadly we've done placements into aged care facilities at the RMIT Sports Academy, and more recently we've started to engage with occupational rehabilitation consultant companies, and I'll talk a little bit more about that in a moment. Next slide, please. So these are our industry partners that we're more expanding all the time. Osteopaths now are looking at more broader careers within the occupational rehabilitation space. So we've made some partnerships there with some big providers. You'll see there that we're APRA registered practitioners. That's a really important partnership that we have. And we're obviously recognised by Osteopathy Australia, which is our peak body association. I couldn't possibly fit on that page how many private providers our students do their external placements with in their final year of the program. So what we have as an alternate opportunity to the RMIT Health Clinic is mentored integrated practice learning. And so on those placements, you go out to osteopathic practices all around Australia and have those very exciting hands-on mentoring sessions with established osteopaths all around Australia. And obviously that leads to really fantastic career pathways. Next slide, please. So the career outcomes is pretty much where I'm heading with that last slide as well. Lots of people work in private practice, and certainly that was my first port of call when I left my studies. I worked in a multidisciplinary practice, which means that I had colleagues who were osteopaths, who were chiropractors, who were physiotherapists, who were exercise physiologists. So working in a big multidisciplinary space is something that we really try to prepare you for. You could work on your own in a sole practitioner practice, or you can work in a partnership with another osteopath or another profession. There are these increasing opportunities with occupational rehabilitation providers, but there are also osteopaths working in all sorts of health-related industries. So I really want to focus a little bit more on that it's not just about getting a job in a private practice. If you take on an osteopathy degree, you can be looking more widely at health because there's so many of the transferable skills that you'll get over the 5 years that you're with us. Obviously, you could end up like me and end up working at a university or doing some research in the field, which of course we always need more people interested in research. Next slide, please. Oh, maybe that's it. Thank you. Thanks, everyone. Thanks, Tony. Back over to you.
Thank you for all the presenters. A quick reminder, our live Q&A tool is open. So please submit your question in the chat function in the right, and the presenters will get back to your questions as soon as possible. Let's take some questions from the audience. Sandra, may I start with you? One of the most common questions we have been always asked by the audience is, what is the most rewarding part of your profession as a health practitioner?
I think this is a really good question, Tony, because if we're not feeling rewarded by the profession that we choose, we've got a lifetime of I'm not sure what. I think we then need to kind of retrain into something else. So what I can say for those out there today, if you love being with people, if you love being energized by being with people, or you do get energized by being with people, chiropractic, osteopathy, Chinese medicine would be great professions for you, because I know when I go to work and I spend time with patients every day when I work, I come home feeling energized. I don't come home feeling tired. And every day when I go to work and I see my patients get good outcomes, meaning they find they get less pain, they're functioning better, they can do the activities they want to do with their families or their friends. How do you think you feel? You feel pretty good. You feel proud to do what you do. So for me, I think that's the most rewarding thing as a practitioner, an allied health practitioner like chiro, osteo, Chinese med. So yeah, just that one thing again. If you love people, you want the best for them, and you feel energized by being with people, these are good professions for you.
Thank you, Sandra.
Thanks, Tony.
A skilled hand and a cultivated mind. This was RMIT's motto back in 1887, and it continued to be used to this date. There's a question about how do we prepare our students for their future career. May I ask Jackie to answer this question? How do we prepare our students for their future career?
Thank you, Tony. I think we spend a lot of time preparing our students for their future career. We spend a lot of time exposing them to very experienced practitioners. We do all of that hard work of the biomed and understanding the human body, and then we give you application of that knowledge. And so that preparation and that understanding is something that we then go and apply in our work integrated learning later in the course. So for the 5 years that you're part of the program, we are really constantly preparing you for your future career, giving you those very clear understandings of the human body and every aspect of that. Then learning examination processes and how do we make decisions about what's going on inside somebody's body in physical examination. Then learning about how we can use our hands and different techniques, and I didn't really go into a lot of different techniques, but across Chinese med, chiropractic and osteopathy, we do learn lots of different ways of applying hands-on techniques to the human body to influence the movement and dysfunction that we may have diagnosed in our patients. And then one of the main things that happens in those later years is that development of clinical reasoning and that understanding that the information that we gather from our patients, how we can apply that information to be making clear working diagnoses and then going forward to having effective outcomes with the treatment that we provide. So thank you, Tony. It's a great question.
Thank you, Jackie. So may I continue with the questions about the student placement, because that's obviously is a very important part of the program. Susie, may I ask you to answer the next question, please? So when our student doing placement, can you elaborate a bit more about the placement at RMIT as well as the external placement? Thank you, Susie.
Thanks, Tony. So students, as you know, we've mentioned the RMIT Health Clinic a number of times. We have this fabulous purpose-built clinic, which our students will begin with placements in Chinese medicine. We actually have our students going in about year 2 just to have a look and observe to see what goes on and how things work in the clinic. And then by year 3, our students are observing in there regularly and learning off their senior students. I understand that chiropractic and osteopathy, they start in year 4 and they start a junior clinic as such, and they are supervised by clinicians who are very well experienced, and they also have buddy systems as well, like we do. They are in there seeing real patients who book in with you from the community, and you're there regularly from the 4th year onwards to see your patients, learn to apply the skills that you've learnt throughout the last 3 years. And as Jackie said, learn those very technical skills and the nuanced skills that you will need to become the practitioner once you graduate. We closely monitor you to make sure that your skill sets are improving each time that you're in the clinic. And we also have created a virtual clinic as well, so that we're applying simulated clinic with the students to help them with their communication skills, help them with their clinical reasoning, have that time within that virtual clinic, so that they're seeing lots of different clinical conditions that sometimes might not present in the health clinic, and learning about the nuanced ways of maybe how you apply different techniques, how you apply different, why would you choose one acupuncture point or one herbal medicine over another? And that's really honing in those skills that you will apply once you actually graduate as well, and have the confidence once you actually leave RMIT as well. Sandra and Jackie also mentioned clinical placements in the community. So these are with health practitioners who are volunteering their time to support you so that you can see what really happens in the community clinic. And that comes down from not just looking at different technical skills, but how to actually run a business as well, because there's a lot of complexity in that when you actually come to running a business. And in the community clinics as well that Sandra has with Fitzroy Stars and so forth, that is actually working with specific groups of people as well, in CC and in the aged care area. Those are all very valuable experiences that you have out of all of the different sort of age groups. So, one is a sports medicine sort of type of area. Another is looking at aged care and how you can help the elderly and grow a healthier life as you're getting older as well. In Chinese medicine specifically, and also Sandra mentioned we have international experience as well. So Chinese medicine students go off to China and in a very, very busy hospital, seeing hundreds of patients a day, and having a feeling of what it's like to integrate both Western medicine, Chinese medicine in the hospital sort of setting, and other sort of international experiences as well. We also have lots of other sort of opportunities for students apart from the private health clinics as well.
Thank you, Susie. And there's a question from the audience asking about in year 4 and year 5, whether students will get paid for doing their placement?
Unfortunately, students do not get paid during placement, but they are in their clinics having lots of experience and gaining experience through the hands-on activities that's applied to them.
Okay, thank you, Susie. I would like to ask Sandra for the next question from the audience. Do you work with other healthcare professions?
Thanks, Tony. Yeah, we do. So you'll find out in practice that there's a lot of multidisciplinary clinics in and of themselves where chiropractors, osteos, Chinese medicine practitioners work within other clinics with GPs, physiotherapists, and other allied health practitioners. And then even when we're not working in a multidisciplinary clinic, we work with other health professions to actually bring about the best health outcomes for our patients. We do that all the time. So where I, as a chiropractor, have a patient that presents to me with their presentations that's outside my scope, I would find the best practitioner to work with to support that patient with that presentation. And I would say that that is the same for all of us here today, chiro, osteo, and Chinese medicine. Does that answer your question, do you think, Tony? Or the...
Yes.
Yeah, thanks.
Thank you, Sandra. There's questions about like the students. What do they enjoy the program the most? Jackie, may I get you to answer the question? What do our students enjoy the program the most from your experience as a program manager, as course coordinator?
Certainly the students love doing the hands-on skills. I mean, I think that's why students are drawn to professions like osteopathy and chiropractic and Chinese medicine, that they know that they're going to be learning skills that are hands-on and that they're going to be learning skills that are going to help people. So if I just think back to Sandra's response earlier about what are the things that we love so much about these professions, and partly for me, it's absolutely you're learning to help people, and you're entering a profession where something different happens all the time and you really don't know what your day is going to look like or what your patient is going to present with that day. So it's learning hands-on practical skills that you need to be very nimble and very agile to adapt to the presentation of your patient in front of you. But as far as the sort of things they enjoy most while studying with us at RMIT, I think they really love that we have experienced practitioners there guiding them right throughout the 5 years of the program. So it's not just something that happens at the end that you meet some experienced practitioners. Our team at RMIT has experienced practitioners right throughout their study time over the 5 years for us. So I think there's real opportunities to learn and grow and feel inspired every day as a part of this program. And certainly that's across both Chinese med, chiropractic and osteopathy. The practical classes and those interactions that we have with real patients are fantastic, but obviously sometimes we have to work in a simulated environment. And thank you, Susie, for reminding us all that at the moment, you know, seeing patients can be a little tricky for our students. So we've also really worked on our virtual and simulated components of our programs, and that really uses our experienced practitioners' knowledge, and they bring to us real case scenarios for students to work through when we're not able to be face-to-face with patients. So there's lots of really great application components to the courses that I think students really enjoy. Thanks, Tony.
Thank you, Jackie. There's questions about what challenge did COVID pose to the course, and how do you overcome that in the course delivery? Does someone take this question?
Well, I think I almost answered it not knowing. Sorry, I didn't see that question in the chat. But a big part of what we've been doing is trying to simulate our face-to-face interactions and our practical sessions. So we've been really working on how best to deliver this type of education when we are limited in the face-to-face interactions that we have. So we do have amazing resources in a virtual clinic situation, and we're able to do really incredible things around live streaming events and really interactive classes and sessions through our learning management system Canvas. So there's so many things that RMIT already had that we were able to very quickly pivot to more online learning in these circumstances. Obviously, we then consolidate when we're able to be back face to face, and that's a really important part of the program. But I think one of the amazing things that's happened over the last 18 months across all three programs is that adaptation and that pivot to online to make sure our students are still getting that key information and getting that clinical education. Thanks, Tony.
Thank you, Jackie. There's a student asking questions about, oh, it's not a student, it's a prospective student. I already count you as one of our students already. So a student asking about a program structure. May I ask Sandra to answer this question? It's about the format of the 5 years degree. Can you elaborate a little bit more for the 5 years double bachelor degree? What will you cover? And please, Sandra.
Oh, Tony. So in the 5-year bachelor's degree, you need to do the 5 years to actually come out with the double degree. We cover all of the biomedical sciences that we've talked about previously, all three of us. We cover the chiropractic or osteo or Chinese medicine specific courses to assess and assess a patient and the treatments we would provide. And then, of course, we have the clinical courses where we actually practice our art of chiro, osteo, or Chinese medicine within clinical environments. Once we did have programs that were undergraduate programs and masters on top, but now our programs are actually double bachelor's programs.
Yeah.
I think that's it, Tony, really.
Thank you, Sandra. The following up question about the career outlook for chiropractic. And can you elaborate a bit more? I know you had already answered that in your presentation.
So the career outlook for our programs is quite good, according to data out there. Many of our students go into private practice, but more so into, well, not more so, but also into other areas like sports, into companies that may provide treatment to their patients who have work injuries. What else? People can go and work with WorkCover, TAC. They can do research. They can become an academic. So there's lots of areas that our students can actually move into once they actually graduate.
Thank you, Sandra. There's a question is for Susie, please. Actually, it would be helpful for student interested in chiropractic osteopath as well, because the student, they want to know what the entry requirement, how can they prepare themselves better to get a better chance to get into the program if they're a mature age student. Thank you, Susie.
Thanks, Tony. So as a mature age student, obviously you might have had lots of different experiences coming from different areas. The entry level for the three programs, Chiro, Osteo and Chinese Medicine, are all related to Year 12 English. However, there is the other statement that says equivalency as well. So if you've done something, another degree in accounting or IT or engineering, that sort of type of thing as well, then actually you've exceeded that Year 12 equivalency and you would be eligible to apply, even if you haven't got any background that you've done before in either Chinese medicine, chiro, or osteo as well. It also includes like TAFE as well. So if you've done a TAFE certificate or a TAFE diploma, then that's considered an equivalent to Year 12 level as well. So of course, if you've experienced it, and most people who come into the program have experienced either Chinese medicine, chiro, osteo, and that's how they get interested. Like Sandra mentioned earlier with her original presentation, then having that interest also helps as well. But in terms of the actual entry requirements, you don't need to have gone to see an osteopath or gone to see a Chinese medicine practitioner. You can have an opportunity to come into the program and go to our RMIT clinic and have the experience there as well. Does that answer your question, Tony?
Yes, so I hope that answered the question from the audience. There's a questions about the possibility of the allied health or complementary medicine, including chiropractic, osteopath, and acupuncture, whether it will be available in the hospital setting. So I think I will take that question. Now, as the presenters mentioned, it's very popular in the multi-center hospital, medical clinic environment. We have different health practitioners working in the same area, so they refer to each other. Now, in a hospital environment, it's more popular now for some services, for example, acupuncturists and so on. They're providing part of the research program. So that evidence have been conducted to show the useful of having such services in hospital sector. So we would look likely to see in the future and more opportunity to incorporate those services when possible. So just a reminder for the questions. Please submit your questions. We still have a couple more minutes available. So if you have questions, use the live event Q&A function to submit the question. We will try to answer your question as soon as possible. So for today, there's also questions about the entry requirement. Again, this is very popular questions when study in the program, like for year 12 and mature age students. I could strongly encourage you to get in touch with our RMIT Connect. Go into RMIT website and follow up with the questions specifically for your personal situation. We will try to answer to you with the full detail provided based on your situation, because for each individual, the situation could be slightly different in terms of like your year 12 graduate, or year 12 leaver from other state, from overseas, or from you're already starting another programs. So that is very different responses. So I will encourage you to contact RMIT Connect and submit your questions, and we will get back to you. So I think that is all we have time for today. Thank you for joining us at RMIT's talk on allied health and complementary medicine program. If any of your questions couldn't be answered today, please check the RMIT website, the program information guide, and contact RMIT Connect. We will get back to you. Have a nice day. Thank you for joining us